In summer, we often spend more time by the pool or on the beach or just outside in general.
Well, now is the time to speak up about the dangers of skin cancer. Bridget is standing by now to ask a doctor.
Skin cancer is America's most common cancer. Fortunately, it is also one of the most preventable ones. Joining us today to talk about melanoma awareness is Laura Mays, a local dermatology physician's assistant. Thanks for coming in.
Thank you for having me.
You know, summer just started for the kids. Everybody's outdoors a lot in Florida anyway. What is the climate like for just the occurrence of melanomas in this area?
We're actually the second highest rates of melanoma in the country here in Florida.
Wow.
So, we really want to promote, especially with being Melanoma Awareness Month, we want to promote skin cancer awareness and getting skin cancer checks. Here in Florida, we recommend that, residents get checked at least once a year by a dermatology provider for a full body skin cancer screening.
And I've noticed that, sometimes it's hard to get into an office, like if they're booked up. And what's your recommendation on getting in and making sure you get those annual checks?
I would actually book way ahead of time.
Okay.
Keep it on a
Keep
schedule,
it on the calendar.
just like you would your annual physical with your primary care physician. You want to make that a priority for sure.
What if you have something you're worried about that you've noticed and you want to get it checked right away?
Usually most offices, like my own, we take those phone calls and filter them in. If there's a concern or if a lesion's itching, bleeding, changing or growing, some warning signs, they go to the top of the list and we do our best to work them in.
Yeah, and when it comes to melanomas, there's a lot of misconception, but it affects all skin tones, all races, genders. It does not discriminate.
That is one of my favorite lines that I say when I go and speak. Bob Marley was a reggae star and died in 1981 at the age of 36 from melanoma. So it does not discriminate, and we want to educate all population, and definitely save lives.
Yeah, and what are some of the areas that maybe people might not be thinking to check that could really be at high risk?
The areas that people are shocked when I tell them is it can happen inside the eye, inside the nostrils, on the lips, inside the mouth. It can actually happen on the palms of the hands, soles of the feet, fingernails, toenails, even anal and genital areas.
Wow. And so when it comes to protection, what are some of the rules of thumb when looking for the right protection? I mean, because sometimes different sunscreens irritate us. We've heard lots of things about some of these ingredients.
Sure.
What do we need to look for when trying to protect ourselves?
We recommend a more mineral-based sunscreen, so your more zinc oxides, titanium dioxides. Those are going to be a little more just a physical blocker, not just helping block against UVA, but UVB as well. So, and of course, a wide brim hat, some sunglasses, and some sun protective clothing is very helpful.
Yeah, I tend to get skin rashes on my arms and legs, so I like to wear the rash guards. I mean, it's not the most fashionable, but sometimes you have to choose.
Yeah, better than being, having a skin cancer and having to have a surgery. So
Exactly.
You're doing the right thing.
And this leads me to that ABCDE. Can we quickly go over that when we're thinking about, suspicious areas? What does that stand for?
So the ABCDEs are melanoma screening criteria, and it's asymmetry. So if one half doesn't match the other half, if you picture it cut in the middle, border is a regular border. So if you have scallop borders, if the borders are kind of jagged, that is not something that we would like to see in a mole. Color is 2 or more shades of one color or 2 complete colors. So we see light brown, dark brown, and maybe some black, or we see a little pink in there. That constitutes a little bit of a red flag. Diameter, most melanomas are over 6 millimeters in diameter, which is about the size of a pencil eraser. However, you can have a melanoma that's smaller than that, so we don't want people to kind of take that as a guarantee. But it's something that's fast growing. That's where the E comes involved. That's evolving, so any change in a lesion, changes in colors, texture, elevation, that type of thing.
And what's really encouraging, you brought in something that's an advancement in how you screen these types of suspicious areas. Tell us about it.
So this is the DermTech melanoma sticker test, and it detects changes in the skin's RNA and DNA so that melanomas can be detected earlier. So this is a nice tool for patients, especially if it's in a sensitive area or perhaps they're a little gun shy to have a biopsy, which some people are. So this is going to alleviate anybody having an excuse not to come in and get checked because we have an alternative test.
So it's much less invasive. So what would happen? What are sort of the steps that would happen with this sort of sticker, if you will?
It's amazing. Well, basically, you take the sticker, the provider will take the sticker and place it over the suspicious lesion, press firmly, and then they just draw a circle around the lesion. And then after they remove it, they place it on the collection kit. This happens 3 more times, and then this whole kit is sent to the Dermatech Gene Lab, and the test can rule out melanoma over 99% of the time.
That's much less intimidating than the biopsies of days gone
Absolutely.
by. And this is covered many times.
Many times, absolutely. And the company is very good at working with, if there was an issue with billing, they like to work with patients because they're very passionate about preventing melanoma, as I am as well.
So don't let it stop you from getting it checked.
Absolutely
That's
not.
super
Please
easy.
don't.
All right. Well, thank you, Laura, and hopefully
You're welcome.
people will get in, get checked, and
Wear their
protect
sunscreen.
themselves. Yes. All right. Back to you, ladies.